So I'm Chidimma Abanulo. I'm a urogynecologist here at Femme Flôr, and
I'm Jessica Benedict, nurse practitioner.
And we want to welcome you guys. Thank you for coming. This is the first of our series of Femme Flôr Tuesday Talks. Super excited to launch these series. We have been open for about 2 years, and one goal that I've always had when in starting this practice is to really have an impact on how the women in our community navigate and understand their health care and how to really achieve what you feel is your best outcome. And so my hope is that as we do these talks in these series, we can start to kind of increase and grow our empowerment and really just our day-to-day existence and healthy living. So our first talk today is really looking at the differences between primary care annual exams versus a gynecologic woman exam. Okay. So I'm gonna turn it over to Jessica. She is our queen of gynecology, queen of wellness. And so I really just would love for you guys to hear her out, interact with her, and then pick her brain about questions that you might have. Okay.
For those of us who are on Zoom, if when we get to the question and answer portion, if you just want to stick any questions you might have or any comments you might have in the chat, we'll get to you guys when we get to that point. I always like to start things off with a very brief icebreaker, so just take a couple of seconds. I like to know how everyone got their first name, so if you just want to introduce yourself and tell me how you might have gotten your name. If you don't know, that's totally fine. So I can start. Again, I'm Jessica. My middle name is Danielle, and my mom was convinced she was having a boy. And so back in the 80s, Jessie was a really big boy's name, and so I was supposed to be Jessie Daniel. Here I am.
Yeah.
So here I am.
That's awesome.
Yeah.
Well, my full name is Chidimma, which means God is good. And I was born on a Monday, and in our tribe in Igbo land, there's a list of names that you choose from depending on what day of the week your child is born. And so this was the name my parents chose.
Very cool. Awesome.
I was named after my mom's best friend.
And what's your name? Sorry.
Anne.
Anne. Oh, very nice. Oh, that's
That's
sweet. Awesome.
My name is Summer. I was actually born in October, but it's my mom had to have a C-section, so she kind of got to pick when she was going to have me.
Okay.
And so she says my dad was driving her to the hospital, that it was a beautiful summer dawn day. So
All right.
summer dawn.
Oh,
There you go. I like that.
That's kind of cool.
Awesome.
I'm Courtney, and I'm the middle child, the second child. So my first name was created, I guess, because it matches my sister's name, who's Brittany, and the last 4 letters of our first name and middle names match.
My name's Karina, and my sisters picked out my name from a book that they were reading, and they just liked the name.
All right then.
And my middle name is Michelle, and my parents were convinced I was a boy, so they tried to name me Miguel.
Oh,
So came out as
hey,
Michelle.
there we go. Awesome. All right, guys. I just want to go through a little interaction here, super quick, easy. So I'm going to fire off some questions, and you can just tell me what you think the answer is. It's just super easy, I promise. All right. So first and foremost, which exam is designed to focus on overall health screening and disease prevention? Is it a primary care or is it women's health? What do you think? Raise your hand. Primary care. Okay. Women's health.
Primary.
I love that. Somebody in the back. I love it. That is correct. Primary health. However, we'll get to a little bit of a difference here as to my practice, the way that I've built it over the years. All right. Let's see. This one should be a no-brainer then. Which exam typically includes a pelvic exam and or a pap smear? Well, woman or primary?
Gynecologist.
Yay! Fabulous. All right. This one might be a little more tricky. True or false, a well woman exam automatically includes preventative services. True or false? No.
No. Nope.
Nope.
I heard a no. Anyone think
No?
of that?
Anybody else? I love it. Yeah, shake it. I don't know. It is actually false. Okay, we don't always focus on the preventative services aspect, but then again, in my practice, I look at my patients as very much a whole individual. So if you've ever had a preventative exam with a a primary care provider, I've heard feedback. I can't speak for it personally, but I've heard feedback from patients that, yeah, they didn't even touch me. They might have listened to my heart and lungs, but we talk a lot about other things like cholesterol and heart health, but there's not a whole lot of hands-on approach. Well, when my patients see me, I do a thyroid exam, I listen to heart and lungs, of course I do a breast exam and a pelvic exam. I also talk a lot about gut health, hormone health, menstrual health, all of that. So it's all encompassing with me. Now, if you come to me with a broken arm, that's a completely different story. Broken bones and I do not get along, okay? If you come with an ear infection, maybe a little bit, but not so much. So we're talking more of the preventative aspect of things. Which leads me to the question of, do you guys know what the recommendation is for when well woman exams are supposed to stop?
They aren't.
Yeah, exactly. They're not. So there is this kind of train of thought out there that, after a certain age, we no longer need these exams. Well, that's not the case, right? Because you still have breast tissue, you still have pelvic organs, some of us, not all of us, that we are concerned with. And so I still like to see my patients. I don't care if you're 95 or if you're 15. I want to see you on as much as a yearly to every other year basis, whatever is allowed by your insurance.
Yeah. And I'll also just tag on to that. So I feel like, because I'm also pretty thorough too, like we do a full dress down, we do heart, lungs, we feel for lymph nodes, we do an abdominal exam, I'm listening to your tummy, I'm asking about your GI health, I feel like in doing that, I get a better view of your entire skin, head to toe, number one, and then also no one else is doing that breast exam, no one else is looking at your vulva, the vaginal tissue, and these are also places where cancer can occur. So even if you don't have a cervix, it doesn't mean that you're cancer free. And just to touch on the point of we don't know, a lot of women assume that after a certain age or after they're done having kids that they don't need an exam. But the woman of today is saying, I want to be here for a good time, not just a long time, right? And so that means being intentional about preventing any cancers that could be present from impacting the quality of your life at 60, 70, 80, 90, 100, right? And so it's so critical to really think outside the box when society wants you to think oh, well, you're done having kids, whatever happens to you, it's fine. We really do believe in restoring and chasing and what I call aging defiantly. I heard that on a podcast. I'm not the first person to say that. But as we age defiantly, we say, no, I know that you might not think I need this exam, but I want to make sure that everything looks good so that I'm confident in my health.
And one of the things that I have come across that I absolutely love, and this is a quote, so this is not my quote, but awkward questions save lives. So I always encourage my patients, ask the weird stuff. It's okay. We've heard a lot of stuff that might be completely off the wall. Nothing phases us. Same goes with when you come in for an exam. I always love the patients that are like, oh, I forgot to shave my legs. This is not a bikini competition. I don't, that doesn't faze me. Yeah. You can't scare me. I always joke around. I have a 17-year-old son that plays lacrosse. That's scary. This is not scary. Yeah. Okay? And we want you to feel comfortable and be able to ask those questions because they really do save lives. And to kind of touch on your point with the cancer aspect, I can't tell you how many times in passing with my peers and even patients, they've said, oh yeah, back in the day, or this happened or that happened. Oh, I had my gynecologist, she found melanoma on my vulva because that's the only place it showed up.
Right.
So again, all the more reason to continue these exams well past whatever cutoff somebody wants to tell you is where it's at. So, all right, let's see, another question. Let's see. Which exam focuses more on lifestyle factors like diet, exercise, and smoking? Would you say well woman or preventative medicine? PCP kind of thing. What do we think? Well woman? It's a tough one, right? Okay, if you're my patient, it's both. It's both. 100% both. I'm always going to be checking in on those things. I'm going to check in on mental health and well-being. I'll check on hormones like we talked about. And of course, those lifestyle things that can be. All right. Bonus question. Can you have both a preventative exam and a well woman exam? Yeah, within reason. You know, I have patients who, if you come in and, you know, little things here and there, hey, I've got this heart disease in my family, what can we do about that? Great. I will set you up for appropriate screenings. If you come to me with a concern, absolutely, we will try to address it within reason in that time. It might include, hey, you know what? Let's focus on this today and let's reschedule your well woman exam so that we can focus on the preventative aspect of things. So I just like to point out that yes, there are times where they can be combined. All right, now just for a little fun, if you will. More quotes, because I always love the funny things in life. We pride ourselves here. We do not have paper gowns, but I absolutely love this because I definitely have felt this personally and professionally. A paper gown is legally required to be too small. I think that's a definite. A definite. Oh my God. Awkward silence is part of the package. Yeah, it's okay. Stare at the ceiling, do your grocery list, whatever you need to focus on at that point.
I have these patients who are just like, well, let me take a step back. You know, gynecology used to be predominantly male, field, and now it's predominantly women. And so my older patients who just, they love to talk, and they're like, I used to have this doctor, he thought that was the best time to ask me about my Christmas shopping, like right when he placed the speculum in. And I'm like, just get it over with. And so I don't do small talk when I'm doing an exam. I'm just like, let's just be done. Yeah.
Well, I will say, here's a good quote on that. Small talk during the exam is an extreme sport.
Yes, it is.
It is. You gotta pick your topic real careful at that moment in time, right?
Yeah.
So, yeah.
That is so funny.
How about the anxiety that lasted 3 weeks, but your exam that lasts 5 minutes? Maths, right? Yeah, that sounds about right. What else? The stirrups exist to humble us. I know. We haven't found a better way.
I know. The day that we find it, we'll retire.
Yes, absolutely. Yeah. More to come on that. More to come on that. All right, and then my last but not least, my favorite is scoot down a little more means farther than humanly possible. Because we've all been there. Yeah, love it more.
I know. Even I don't get it right. I'm like,
oh no, I know.
She's like, Chichi, you're still not done.
Yeah. Hold on.
I'm coming.
Yeah. All right, so that's my humor for the evening. I will open the floor to questions here in a moment, but before I do that, feel free to grab some refreshments. Those of you on Zoom, don't forget, please put it in the chat so that we can review those. Do we have some currently?
Not yet.
Not yet. All right, please, questions. Common questions. When did PAPs happen? When did they not happen? Because there's always been a lot of talk, especially when the pandemic hit, there was a lot of confusion as to when do I get a well woman exam? When do I need a pap smear? On average, age 21 to 30, pap smears are every 3 years. And then from 30 to 65, they're every 3 to 5 years, kind of depending upon what you and your provider choose. In certain cases, if you have history of abnormal pap smears, that timing would be a little bit shorter than that. However, people hear 3 to 5 years and they go, great, I don't need to see you for 3 to 5 years. Right. That's not the case. Again, a lot can happen in a year. So I want to see my patients on a yearly basis. I want to check in. I want to get a pulse for how things are going in your life. Again, not just the breast exam and the pelvic exam. I want to know, how is your GI system going? How's your mental health going? Yeah.
How about if you've had a hysterectomy?
Perfect question. Yes, I still want to see you, even on a yearly basis. Because as Dr. Abanulo had alluded to, even if you don't have a uterus or say a cervix to need a pap smear, we still do a pelvic exam. Let's say your ovaries still remain, right? We still want to be able to feel for your ovaries and detect any concerns and any lovely pelvic dysfunction that I can then pass on to my lovely partner here. Hey, let's help out, right? Because that's all perfect times to check in, right? One of my first questions is, how's your bladder doing? You got any leakage going on? Any concerns? Any pain with sex? How's that?
Yeah.
Yeah.
Yeah, people are definitely not asking that. And there are a couple of conditions just off the top of my head that no one else is going to detect unless you're doing a pelvic exam. One of them is lichen sclerosis, which is where the vulva can change over time, and it does carry about a 5 to 6% chance of becoming cancer. And so those women need an exam twice a year for surveillance, but if you're not going to someone for 3 to 5 years, there's no telling where we'll meet you in that pathway. And then the other one is our urethral diverticulums, which can become adenocarcinoma if left unchecked. And so this is the woman that's having recurrent bladder infections that may not present the way they usually do. She may be having vaginal pain, urethral pain, and so we want to catch that at a good time and treat it. But again, because we kind of downplay a lot of our symptoms, some women will go 3 to 5 years and just say, I've just been dealing with it, you know, and then by the time they come in, it's advanced. So it's really good to continue to have those exams. Talk to us about in my mind, it's the triple threat for breast cancer detection. What is that still true?
Yes. So I think that also goes hand in hand with the pap smear discussion, because I think that the waters have become a little muddied with that. There's 3 kind of preventative task force, if you will, that put out various recommendations in terms of pap smears, in terms of especially breast health and say mammograms. And there's a lot of confusion around when I should be doing mammograms, when I should be doing breast exams, that kind of thing. The approach that I take that is very important is a yearly breast exam at a minimum, unless you're at a high risk, first degree relative with breast cancer, a genetic mutation that predisposes a patient to breast cancer. All the more reason that you and I should be having those conversations to see if I need to get you in a high risk breast clinic versus seeing me every 6 months for a clinical breast exam. But mammograms in particular, I still believe in yearly to every other year based on a normal kind of general population risk profile, because it's our best detection that we have available. That coupled with seeing me on a yearly basis for a clinical breast exam is kind of the best catch that we have. Now, of course, if my patients say, hey, I've got this thing that happened where I've got this discomfort, or again, no question is awkward to us, no statement or concern is going to throw us for the loop. We're going to go, okay, great, let's deep dive this further. So if you come to me and you're like, my skin has changed a little bit.
Weird, yeah.
It's just a little itchy.
Put your finger on
It's just something's off. I can't tell you how many times I've heard something very similar to that, and I've sent a patient for imaging. I don't see anything, I don't really feel anything, but let's just send you for imaging. And that has probably saved a handful of my patients.
Bringing it up.
So it is still very important, because the unfortunate aspect with breast cancer and breast health is it does tend to be put on the back burner. As you were saying, a lot of patients tend to, I'm okay right now. This pain that I'm having, it'll go away, or I don't feel any lump. The skin is fine. It's probably eczema or something along
Or they
those
say,
lines.
well, it hurts. So it's
I
not.
want it done though.
So going back to that triple threat, it's a breast exam on your own, and then a clinical breast exam, and then the mammogram. And those are the kind of the 3 things that we want women to be doing. Do you have a certain time of the month for people who still have periods for when they should be doing their self-breast exam?
Yep, absolutely. A week after the period is always best. If you do it a week before or during your period, your breast tissue is always going to be more lumpy bumpy. It's more kind of reactive to the hormone shifts that happen, and things might be more tender, and you might feel breast cysts or what we call fibroadenomas, which are benign growths that can react to hormones. And so what I tell my patients is get in the shower, soap up really well, and examine your breast tissue while you're in the shower, because your fingertips will glide over that tissue so much easier. The thing that we're looking for is something that you're going to be your best person to understand what your normal tissue feels like. So the more you do this on a consistent basis, month after month, even though the recommendation has changed, I still recommend monthly exams, self-exams in the shower. The better you're going to be at saying, hey, you know what, this is off. Something doesn't feel right. But things that feel like a frozen pea or a pebble, it's really irregular shape, maybe really bumpy, doesn't feel smooth, it doesn't move around, maybe it is painful, maybe it's not. Those are times where you need to be coming in to see me. If you're having any nipple discharge where that's a new thing for you, you've never had that before, especially if it's got a color to it, blood tinged, absolutely, you need to be seeing me immediately. If you are noticing those skin changes, don't write it off. Come in, let me do an exam, let me see what it is. And if it's something as simple as, great, this looks dermatologic, we can get you referred to the appropriate person to look at that skin change. But I guarantee you I'll send you for imaging first.
Mm-hmm. Right, and in my experience, most primary care doctors are not doing a breast exam.
Very true.
And I also I see it as like where I took my daughters to get their ears pierced. I took them to someone who does them day in, day out. They can do it in their sleep. That's who you want to do your breast exam, not someone who's only doing for a year or, just upon request. You want someone who's super experienced. I totally agree with everything you're saying. I have a personal family history of breast cancer that didn't show up on one mammogram, and then the next year was stage 2. So I always tell people I'm a big fan of yearly mammograms, and then of course doing those exams as well. And if you feel like you're getting pushback about the frequency of your screenings, like speak up and say, like, this is what would make me more comfortable, as if I kept a closer eye on my care. So it's okay to say that.
Yeah, my regular provider told me at my last visit it's every 2 years now, so I didn't need one.
So again, I think that's a conversation you and I can have, because I can kind of look at your history and your family history to see if maybe we should be doing more yearly exams. And a lot of insurance is still covering yearly exams, even up after the age of 75, which is the current recommendation to discontinue mammograms, which there again, I'm not always in agreement upon certain aspects of that. So if your provider said every 2 years, I have patients that are very comfortable with that. And as long as we've had that discussion and I've given my spiel of at least come and see me on a yearly basis, then I've done my due diligence, but I still recommend yearly, for sure. In fact, I love to tell stories. I had a patient, this was, probably 15 years ago now, very young patient. She had just had a baby. She was probably 40, 41, so young in that, right? And she was breastfeeding. And when you're breastfeeding, you have a lot of lactational changes to the tissue. So it's very difficult to really ascertain normal breast tissue versus not. And she kept coming to me, she said, I just keep getting this lump. And her OB kept saying, I think it's just clogged up. It'll work itself out. She's like, well, okay, it's tender. I get it. No family history of breast cancer. And I saw her 6 months later, she was still having this recurring lump, and it just wasn't going away. It was still tender. And I finally said, you know what? I know you're still breastfeeding, but let's just send you for an ultrasound. It was cancer.
Right.
I mean, it can happen in a blink of an eye. And so I think, especially, when breast cancer affects 1 out of 8 women, I think it's very important.
Yeah. And I think that, that story is so common because it's a story of advocacy, self-advocacy, and then also like reading between the lines and listening to the patient, being like, you know your body, and you want to be able to come to the doctor and be like, I know my body, right? You won't know your body if you're not doing your own breast exams. Someone can really talk you down off the cliff when you should have been up there yelling and saying, no, help me. But that is a story that I hear all the time, is I had to keep saying something, and then finally they imaged it, and by then I was like, this far out. And so I love that story because that is the outcome of listening, which Jessica's really good at, and the patient not giving up on herself, right? So.
All right, I'm going to open the floor. Questions? Any other questions? How about in the back there on Zoom? No.
Okay.
Well, I just encourage anybody to please schedule an annual exam, even if it's a little ways out. That's totally fine. But I would love to be able to at least see you all and provide care and kind of give some guidance as needed. Like you were saying, help you out, figure out every year, where we at, that kind of thing, for sure.
So thank you guys for coming. Thanks for logging on.
Yeah, thank you guys in the back.